By the time most people realize something is wrong inside their body, the cancer has already been growing for months, sometimes years. And the most terrifying part? It rarely begins with pain. It begins with something small, something easy to ignore, something you probably brushed off this morning without even thinking about it. A 58-year-old woman in Ohio kept feeling unusually tired after lunch. Nothing dramatic, just a heavy, sinking exhaustion she couldn't explain. She blamed her age. She blamed the weather. She blamed stress. 3 months later, doctors found a tumor the size of a lemon growing silently in her pancreas. And when they asked her about her symptoms, she froze, because she had felt it. She had ignored it. And now it was almost too late. This is the part nobody talks about. Cancer doesn't announce itself with sirens. It whispers. It hides behind everyday symptoms, the fatigue you blame on bad sleep, the bloating you blame on dinner, the bruise you swear came from nowhere. And by the time these whispers become screams, the disease has already taken ground inside your body that's nearly impossible to reclaim. What I'm about to share with you are the silent signals doctors say are missed in nearly 70% of late-stage cancer diagnoses. The signs your body sends long before any scan, any blood test, any specialist confirms what's happening. If you're over 40, this could be the most important 6 minutes of your week, because one of these symptoms might already be sitting quietly inside you right now. Here's something most people don't understand. Cancer isn't a sudden event. It's a slow betrayal. Every single day, your body produces thousands of abnormal cells. Normally, your immune system finds them, marks them, and destroys them. But when something disrupts that process, chronic inflammation, hidden infections, toxic exposure, even prolonged emotional stress, those rogue cells start slipping past your defenses. Quietly, patiently, multiplying in places you can't feel. And this is where things become frightening. As the tumor grows, it doesn't just sit there. It demands resources. It steals nutrients from your bloodstream. It releases inflammatory chemicals that affect your energy, your digestion, your skin, even your mood. That's why one of the earliest signs is something most people would never connect to cancer: a strange, persistent fatigue that doesn't improve with sleep. Not tiredness, exhaustion, the kind that settles into your bones. A retired teacher in Arizona described it perfectly. She said she felt like she was carrying invisible weight every morning. She drank more coffee, she slept earlier, nothing helped. 6 weeks later, she was diagnosed with stage 2 colon cancer. Her tumor had been quietly bleeding into her intestines, dropping her iron levels, draining her energy long before any other symptom appeared. And what researchers discovered next shocked even seasoned oncologists. Many cancers release substances that suppress appetite without the person realizing it. You eat slightly less, you lose a few pounds without trying, you feel proud until the scan reveals the truth. Unexplained weight loss of even 10 pounds in a few months is one of the most overlooked red flags in modern medicine. Then there are the skin signals: a mole that changed shape, a patch of skin that itches without rash, a wound that refuses to heal after 3 weeks. These aren't cosmetic issues. They're often your body's first visible cry for help, and almost nobody notices them in time. Most people don't die from cancer because of the cancer itself. They die because of what they did or didn't do when the early signs appeared. The first mistake is blaming everything on age. Tired? I'm just getting older. Bloated? It's just my stomach. Pain in your back? I must have slept wrong. This is the most dangerous form of denial in American health today. Your body isn't supposed to feel worse every month. Persistent symptoms are not normal aging. They are messages. The second mistake is waiting for pain. Here's the truth nobody likes to hear. Most early-stage cancers are completely painless. The pancreas, the liver, the kidneys, the ovaries, these organs have very few pain receptors. By the time you feel pain, the disease has often spread. Waiting for pain is waiting too long. The third mistake is skipping routine screenings. Colonoscopies, mammograms, skin checks, blood panels. Americans skip these appointments at alarming rates, especially men over 50. A 15-minute screening could literally add 20 years to your life. The fourth mistake is trusting the internet over your doctor. Searching symptoms online creates either panic or false comfort. Neither saves lives. A real conversation with a physician does. The fifth mistake is ignoring family history. If cancer runs in your family, your screening schedule should not look like everyone else's. It should start earlier and happen more often. Genetics isn't destiny, but it is a warning. Now, here's the hopeful part. Because for every silent warning sign, there's something powerful you can do right now to protect yourself. Start with your plate. Doctors at leading cancer centers consistently point to one simple shift: reduce ultra-processed foods and add more colorful vegetables, especially cruciferous ones like broccoli, cauliflower, and kale. These contain compounds called sulforaphanes that have been shown in studies to support the body's natural cancer-fighting pathways. Add berries for antioxidants. Add fatty fish for omega-3s. Add green tea for polyphenols. Small changes, repeated daily, rebuild your internal defense system. Next, move your body. You don't need a gym. You need 30 minutes of brisk walking, 5 days a week. Movement reduces inflammation, improves immune surveillance, and helps regulate hormones linked to several cancers, including breast, colon, and prostate. Then there's sleep. 7 to 9 hours in a dark, cool room. During deep sleep, your body produces melatonin, one of the most powerful natural anti-cancer molecules ever studied. Chronic poor sleep is now considered a real cancer risk factor by major oncology organizations. Get your screenings. If you're over 45, schedule a colonoscopy. Women, stay current on mammograms and pap smears. Men, ask about PSA testing. Everyone, get an annual skin check and a comprehensive blood panel. These aren't optional anymore. They're survival tools. Finally, listen to your body. If something feels off for more than 2 to 3 weeks, fatigue, bloating, unusual bleeding, persistent cough, changes in bathroom habits, lumps, weight loss, don't wait. Call your doctor. Insist on tests. Be the advocate your body needs. Here's what I want you to remember when this video ends. Your body whispers before it screams. Every silent symptom you've ignored, every strange feeling you've explained away, every "I'll check it next month," those are the moments where lives are quietly won or lost. The people who survive cancer aren't always the strongest or the luckiest. They're the ones who listened early, the ones who paid attention when their body started speaking softly, the ones who refused to dismiss the small signs. So, tonight, take 5 minutes. Sit quietly. Ask yourself, has anything felt off lately? Anything you've been ignoring? If the answer is yes, make the call this week. Not next month. Not when it gets worse. This week. If this video helped you see something you hadn't noticed before, subscribe to Dr. Ethan Care, because protecting your health shouldn't be a guessing game. It should be a daily promise. And the next video you watch here could be the one that saves someone you love.